So you've been hearing you're getting older, and you hear these things about exercise, and you need to be really mobile. You need to be really stable. Want to know the difference and which one matters most? Watch this. So, you need to be mobile. You need to be stable. Which is it? Make up my mind, right? Well, I'm here to tell you, I'm going to describe to you the difference between the two, and then I'm going to let you in on what matters most. Okay? You ready? So, mobility. Mobility is how much motion your body has. And you can test the mobility of all your joints. You can test the mobility of your ankles, the mobility of your knees, your hips, your low back, your trunk, your neck, your shoulders, your elbows, your wrists. You're getting the picture, right? Your fingers. You can test the mobility of every part of the body. And in PT school, we're taught to do range of motion testing, and we know how much is normal for a joint, and then we compare it to how you present, and then we know what's the impairment, what's the dysfunction. And it used to be years ago, the goal was to increase range of motion. Well, now they're starting to realize, well, does increasing motion 10 degrees in a joint change the person's function? Can they do more now? Do they need less assistance? Are they having less pain? So it's yes, we want full range of motion in all our body parts, but if we don't have independent, pain-free function and we're not able to do the things that we want to do, does improving decreased range impact that? That's what matters most, right? I mean, if my knee only bends to, say, 110, right? Normal might be all the way here. And depending on the size of my calf and my thigh hitting each other, you can see I can put my heel right into my backside. But, so what's that, about 140 degrees or so, depending, 45 degrees? But I really only need 110 to be able to go up and down stairs normally, and to get in and out of a chair normally without compensation. So we have to see, would I be able to sit down on the floor and sit on my heels? Maybe not. But do I need to be able to do that? So we have to start thinking function, right? If someone had a total knee replacement 10 years ago and they can't bend their knee to 140 degrees, does it matter? Is that a goal? So I want to kind of explain to you where the mobility really needs to be in the body, and then I'm going to talk about stability, the difference, and then which one matters most, or what matters most, I should say. So mobility. You want your ankles to have really good dorsiflexion, because as we age, if your ankles don't have good dorsiflexion, so here's my foot on the ground, can I lift my toes up and keep my heel down? That's dorsiflexion, right? My toes are coming closer to my shin. Well, we don't really walk around doing this. This isn't really something we do, although you might do it in a gym against resistance. And I guess it doesn't hurt to work the anterior tib, which is this muscle here, and you'll feel that muscle pop out when you lift the toes up. But what we really want to be able to do is when we go to take a step and we want to land on our heel with our toes up. You'll see a lot of people when they're older, they kind of walk flat-footed. They don't really have good dorsiflexion, right? The ankles have stiffened, they've lost motion. Very, very important to have that dorsiflexion. There's also something about the heel. We want eversion, inversion, which triggers everything from the ground up, which I won't go into detail on in this video. I've gone into detail on that in other videos. And I want to stick with mobility and stability, okay? So you really want good dorsiflexion. That's huge. If you don't have good dorsiflexion at the ankles, guess what? You're going to be walking funny. Nothing's going to be triggered properly from the ground up. You've probably got knee pain. You've probably got pain elsewhere. Shoulders maybe, low back, neck. And it all may be because of no dorsiflexion. And your balance, your stability may be way off because you're lacking that proper motion at the ankle. So that's huge, okay? Next area that's really important is hips. Your hips are the second most mobile joint in the body. Your shoulder is the most mobile, right? Your shoulder can do this. Your hip can't quite do that unless maybe you belong to a circus. If you can, go ahead and, send me an email. I'd love to see you do it. But the hip is the second most mobile joint in the body, which means it has flexion, it has extension, it has abduction, it has adduction, it has external rotation and internal rotation. It's a very mobile joint. It's not quite as potentially unstable as the shoulder is. It's a weight-bearing joint. If it had stability issues like the shoulder, it wouldn't be a good thing because, we're standing on those hips. We're not weight-bearing on our shoulders unless, of course, we're doing a lot of great weight-bearing exercises, which I highly recommend, like push-ups and planks, but planks with three-plane motion, not just hanging out still. There's a lot of great things you can do that it's weight-bearing for the shoulders. But the reason the shoulders have that instability component, again, is because it's the most mobile joint in the body, right? So, and I don't want to get off on a tangent. I've got other videos that talk about shoulder and rotator cuff and how it gets beat up all the time. And we always think it's the culprit when actually it's the victim, because your shoulder has 18 muscles and only 4 of them are the rotator cuff, and the whole rest of the body impacts shoulder function. So just a little quick aside. Okay, so hips, mobility. You want to make sure you've got good extension, because when you go to walk, that hip has to open up in front and extend, right? You want to make sure that you've got good flexion in the hips so that you can do squats. You can get down and get something out from under the sink, right? You can weed your garden, depending on how you weed your garden, whether you squat or whether you kneel or however you do that. Hopefully you're not doing it this way, which I don't recommend. But anyhow, so you want good flexion, you want good extension in the hips. You also want good ab and adduction. You want it to be able to move away from midline. In weight bearing, doesn't really matter if you can do this all day long. I don't know anybody who does this in real life. Is there any reason? Not even in sports would you do that motion, right? So, the non-weight bearing, kicking that leg out to the side is kind of a relatively useless exercise, because the goal is, does it control, right, which is the stability component, but will it be mobile going away from the body in weight bearing? This leg is bearing weight as I do this motion. The same thing when I cross over. So if I take this foot and I cross over, this hip is controlling that motion. There's the stability part, but it's also very mobile. It's getting a nice lengthening into adduction. If I can do this, again, that doesn't really do, obviously we want it to be mobile in that direction, but it's really more important, is it mobile in weight bearing going into that? And then the rotation, same thing. If I'm in my kitchen and I'm going from the stove to the sink and I go to turn, guess what? That's external rotation and it's weight bearing, because that leg is what I stood on when I turned this foot to grab something out of the kitchen drawer, right? So that has to be able to externally rotate in weight bearing. The same thing, internal rotation. Say something's over there and, I might do that. You might do that to turn that way, but sometimes you'll do that and you'll turn. So you need that internal rotation as well in weight bearing. And we use all 3 planes of motion when we walk, and I've got videos on walking, so I won't get off on that tangent, but those hips have to be able to extend and flex and abduct and adduct and externally and internally rotate when we walk. You need all those muscles to be mobile in those movements. Obviously, we're not exaggerating the movements when we walk, but they're required, right? So you need mobility in those hips. And if those hips aren't really fully mobile in all 3 planes of motion, guess what gets trashed? Your low back and your knees. One or the other or both. And a lot of the times we're beating up the low back, and the low back's just a victim, right? I often joke and say you can ignore the low back to fix the low back, because let's see what's going on with the hips, let's see what's going on with the trunk, which is what I'm going to mention next. Do you have good range of motion in the trunk? Do you have good mobility there? If you don't, guess what? Your neck, your shoulders, and your low back, maybe even your hips, won't be happy, because that thoracic spine, which is often called by one of my favorite people to learn from, Dr. Gary Gray from the Gray Institute, he calls it the silent saboteur, because the thoracic spine between the neck and the low back rarely provides symptoms. You don't even know you've lost mobility there, but you've got low back pain that doesn't go away. You've got a shoulder issue that nobody can figure out. You've got neck pain that just keeps coming and you can't get rid of. And you keep going after those parts that hurt, but it's that silent saboteur that's causing the problem and nobody's paying attention to it, right? So you want that thoracic spine to be fully mobile, and it's kind of like Ginsu knives. It'll do it all. It'll flex forward, it'll extend backward, it'll side bend, and it'll rotate. And if it's lacking any of those, now here's for instance, if you struggle to get your shoulder all the way up, so right now, my shoulder is just in front of my ear here, right? Now, if I want my shoulder to come all the way back to my ear, guess what has to happen? The top part of my thoracic spine has to go into extension. If it can't, my arm is stuck here and it won't go further, right? But if I do have good extension in that upper thoracic spine, look how far that goes back. Now, here's a little aside. You might be going, oh, mine goes way back, but look where my arm is. It's way out there. That's abduction, right? That's not flexion. Flexion is here. Think of the soldier with the stiff arms, right? That's flexion. Can you bring it up next to your head and come all the way back? And don't bring your head over here like this, because that's what your brain's going to do. Oh, you want it next to my ear? Here we go. So stand in front of a mirror, see if your head stays straight. Can you get your shoulder next to your head and all the way back? That requires your thoracic spine to fully extend. Okay? So really important that that body part is fully mobile, right? Now, a lot of the times the neck lacks mobility because that thoracic spine is not working right. It's lost movement, or there's some lack of stability from below the neck. The neck is fully mobile. It'll give you a full flexion. It'll give you a full extension. It'll give you lots of side bending, right? I'm a little stiff on my side bending, my upper traps. I do too much computer work and I need to do a little more mobilization on my neck. But I don't mobilize my neck by just making it move. There's lots of great ways to release the muscles. There's lots of great ways to mobilize the neck from below. And I believe I've got some videos out there on that. So back to the topic at hand. Mobility and stability. But first, if you're getting any value out of this, please hit the like button or subscribe if you're not a subscriber. So, mobility versus stability. How mobile is your body? Now, stable. How stable is your body? A lot of the times, the same muscles that control your movement for mobility are also controlling your movement for stability, right? So if I'm, for instance, if I'm doing this, if I'm stepping back down and I'm seeing how mobile my hips are in flexion, that also requires my body to stabilize me as I'm going into that motion. That requires those muscles in the backside of my body to get longer under tension and control the movement, kind of like the reins on a horse, right? So if the muscle doesn't have full mobility, it's going to struggle with stability because it's going to say, well, we can't go very far. Oops, stop. And if it's lacking mobility, it's going to lack stability too because it's lacking function. So the trick answer to the question is neither one is more important than the other. They kind of go hand in hand. Because in order for your body to stabilize, the muscle has to get longer under tension and control the movement. And when you're getting full mobility, the muscle is getting longer under tension also. So I'll see a lot of people when I assess them, I'll see them, they'll go to step back and do what I quaintly call the bow to the king, but they're not stable. They're all over the place. They're, oh my gosh, right? So if I laid them on a treatment table and bent their knee up, they'd have full flexion of that hip, no problem. But it's not controlling the movement. There's no stability there. So mobility, if you go into a clinic and they got you laying on a treatment table or sitting on a treatment table and they're assessing the mobility of your joint, if it's a weight-bearing joint, that assessment is almost useless. And I'm not saying that as a disrespect to my profession or any other profession. It does give some information right? Okay, the joint is fully mobile, but how is the joint functioning in weight bearing? Is it mobile in weight bearing? If it's not, then there's a stability issue. The muscle is not firing properly. It's not controlling the motion. And now we've got some issues, right? So I'm not going to teach any exercises here on this video. This is all about education. You can go to, there will be a link below where you can go to the Move Without Pain private club. There's a free membership. There's a 21-minute video on there that teaches you how to assess your mobility. And if you find you're unstable during any of those motions, they go hand in hand, right? So training your body, there's also a free training class on there, training your body to regain full motion, full function in weight bearing is key. Especially if you don't want to stop hearing that you are getting older, you know, which to me is just a lie from the pit of hell. We are not meant to decline as we age. We are not meant to lose our independence. We're not meant to end up needing disposable underwear. Those are not rites of passage, right? Those are things that we've come to think are true, but they are not. There's a lot we can do to prevent it, to reverse it, or to slow it down if you've got some serious disease or some horrible other, God forbid, thing. Okay? All right. If you enjoyed this, please hit the like button, subscribe, and I'll see you next time.